Hello everyone, and welcome to this session focusing on HIV infection and disease, foundations for care and also for professional practice. My name is David Evans, and presumably we've already met now in class, and you're watching this video as a backup to what we've already done. Usually when I present this session across a whole number of programs, it may have a specific focus. That could be patient pathways of care, international issues, paramedic science, maternity, so lots of different ways, but some of the PowerPoint sets in this particular series I'm giving you now are actually to do with the holistic foundations of care that stretch right across so many of those programs. What we'll do by the end of this session is to critically explore various implications of care relating to those affected by or infected with HIV. And certainly one of the main things you'll learn right from this first small set will be the modes of transmission of HIV. So how does HIV go from one person to another? And in that case, how can we prevent it? And secondly, what are the implications of the virus on an individual's life? It's important to start off with the facts to remind you all that even as far as 2018, there is still no cure for AIDS and no vaccine against HIV. However, if I'd been presenting this session to you 10, 15, 20, 30 years ago, it would have been very bleak compared to the presentation I'm going to do now. So I'm starting off with the really positive ways in which HIV client care has completely changed, especially within this last decade. And that change is brought about by certain ways in which HIV is prevented from going from one person to another. There are some really fantastic and very, very workable strategies for HIV prevention. And what the World Health Organization is hoping to do is to encourage people to take on all of these different ways of prevention. And if the whole world practiced this, then it means that HIV as an epidemic and as a pandemic would fizzle out by about 2030. The problem is that the planet is inhabited by humans, and humans don't often do what's in our own best interest. So there are certain countries throughout the world, for example, where these great aims will not be achieved. And that's mainly down to lack of political will or energy, or maybe sometimes specific cultural, religious, ethnic reasons why these resources aren't being shared equally across the planet. And that obviously has to do with levels of poverty as well. But here they are. Here are the ways to stop HIV in its track. And if only these ways could be implemented more and more, then, as I say, HIV would start fizzling out from about 2030 onwards. At the top of your screen, you'll see the good old faithful condom. Condoms have been around for hundreds of years, and we know now since HIV has been around that they are truly effective. If used properly and consistently, they are completely effective in blocking the transmission of HIV from one person to another. Now, for whole loads of reasons, some people still don't use them. Maybe it's people don't like them, or they don't perceive that they're at risk of HIV, or maybe their religious beliefs or their cultures won't allow them to use them. Maybe they haven't got access to them. And in some parts of the world, we're even reading articles now of people talking about things such as condom fatigue, whereas people are saying that they're really fed up of hearing the message. And I suppose that's like talking to people who smoke, telling them that their smoking habit can cause lung cancer, lung disease and problems, and some of them may be saying, look, we're fed up of those messages, we've heard them long enough. Well, yes, okay, lots of us are fed up of hearing different health messages, but at the end of the day, if that's going to protect you and save your life, then what we need to do now is look at ways of enabling people to overcome the prevention fatigue that these messages are bringing, because the message itself is still sound and solid. A condom will protect against the transmission or acquisition of HIV. That's the one crucial message. The next one is on the part of the slide that shows 90-90-90, and that's the World Health Organization's aim to try and get this implemented right across the world. And if that was implemented, that's going to be a really significant impact to help bring down new HIV infections across the world. And what the 90-90-90 refers to is, firstly, if 90% of people living with HIV infection are tested for it. So with all the people in the world living with HIV, some parts of the world, maybe as many as 30% still have not been tested. That's 1 in 3 people still do not know their status. And therefore there's an implication they could pass that infection on. So WHO is saying, try and test 90% of the world that's living with HIV. If 90% are tested and then diagnosed as living with the virus, if 90% of those are commenced on medication as rapidly as possible, usually in the UK, for example, if somebody tests positive now today is the day in which they started on the medication. Start them on the medication immediately. And if 90% of those on treatment reach undetectable viral loads as quickly as possible, then 2 great things will happen. On the one hand, that person could end up living as long as they ever would have lived without HIV. They can lead fit, healthy lives because the virus is under control. The level of virus is limited to undetectable. That means it's not able to have an impact on the person's body. And the spin-off from that is if a person's living with undetectable viral loads, then it means it's impossible for them to pass that infection on. U equals U. Undetectable equals uninfectious. Okay, that's the key message there. So that's what the 90-90-90 refers to. You can then see in the next part of the slide Prince Harry sticking out his finger for HIV testing. Harry, following on in his mother's footsteps, has actually made great strides in challenging the stigmas and the taboos around HIV. And one of those is to do with testing. In the past, when the treatments weren't good, lots of people would even wonder why they should be tested, and many saw no reason at all in being tested, so probably preferred not to. The encouragement now is to be tested. The message is that it's better to know your status than not to know it, because of the 90-90-90 implications. So Harry is really leading the way here in advocating testing. Then you'll notice on the next 2 slides 2 abbreviations, PEP and PrEP. PEP has been around since 2000 and it stands for post-exposure prophylaxis. So prophylactic, in some languages, for example, a condom is referred to as a prophylactic. It literally means a prevention. So post-exposure means you're preventing yourself after the event has happened. So whether that's through sexual exposure, sometimes referred to as PEPSE, P-E-P-S-E, PEP after sexual exposure, or PEP after occupational exposure. PEP means taking the anti-HIV medication for 28 days after potential exposure, in the hope that that will abort the viral life cycle should the virus have entered a person. PrEP is new, and that's only been talked about in these last 18 months to 2 years now. That's pre-exposure prophylaxis. And it's intended for those people who know that they're potentially at risk of acquiring the virus. Say, for example, in a couple where one person's got the virus and the viral load is still detectable, and the other person has not got the virus, they would be referred to as a serodiscordant couple. If they're seroconcordant, that means they're both the same, so either both positive or both negative. Okay, serodiscordant means one's positive, one's negative. And in that case, the HIV negative person may be taking pre-exposure prophylaxis before the incident happens, over the time of the incident and slightly afterwards, to cover them for that opportunity of the virus getting into them. Okay, that's pre-exposure prophylaxis. WHO says that all those people who are vulnerable to HIV should be taking pre-exposure prophylaxis for the amount of time in their life that they need to in relation to the risk activities. Now, obviously, taking it for short periods of time is going to be far less expensive than someone taking the medication for the whole of their lives. But I'm sure for those of you that follow on Twitter, if you just check out things like hashtag prep works, hashtag where is prep, hashtag prep now, you'll find out that there's a lot of controversy around this, especially with funding within England. It's different in Scotland and Wales, but there has been political and moralistic overtones for PrEP within England. And the final sign you can see here is often abbreviated as TASP, capital T, small a-s, capital P. TASP, and that stands for treatment as prevention. So the moment a person's taking the medication to get the viral load down in them, not only is it treating them, but it's also doubling up as prevention from passing the virus on to others. So these are the new proven strategies. These work. And if only more and more people were aware of them, if they were implemented more, then HIV would start fizzling out of our planet like when I started teaching in 1990, we couldn't have even dreamt of that at that stage. Okay? So that's the great news at the moment. You'll see from the number of people newly infected within the UK that again across the four countries of the UK, the numbers are coming down. This is so much in part to PrEP. And over the next couple of years, we'll see this drop even more, the more people are accessing PrEP. And here's that slogan, U equals you. If you're on Twitter, it'll be hashtag U, write the word equals, and then capital U again. And it means undetectable viral load equals uninfectious. Another one on Twitter is hashtag can't pass it on. Okay, now it's really as stark as that. And for those of you who are nurses, midwives and health visitors following this session at the moment, I won't go through the whole of the Code of Professional Conduct. I just want to emphasise the first bit of it. Because sadly, whenever I'm teaching sessions on HIV, people are still talking about the stigma and the prejudice and the discrimination that goes hand in hand with HIV infection. Whether that means a person living with HIV enters hospital and maybe they've gone in to have their appendix removed and all of a sudden, because of their HIV status, they're sidelined into a side room. Or people talk about putting double gloves on, or people want to wear masks and aprons just to take a food tray into somebody's room. These are all clear signs of discrimination, a breach of confidentiality, and a horrendous mistreatment of other people. Just look at the code. Look at this first opening section of it, and it clearly states that we must put the people that we're caring for or in need of our services foremost. We put them at the front of our care. So all these fears, stigmas, panics, worries, concerns, they're your issues. If you feel like that, that's for you to deal with. You should not be dumping that on your clients. Even when it comes to matters of pre-exposure prophylaxis, you might hear some of the moralistic conversations about this. Even NHS England, sadly, wallowed in the gutter in the way it reported this when one NHS England official actually said something to the media like, well, look, we've only got a small pot of money. What are we to spend it on? People's lifestyle choices or children with cancer? Now, straight away, that's playing into emotive issues, and it's certainly what the gutter press would do. And it's not, this should not be part of our health professional conduct. Okay, just check this out. Look at the ways in which you could read this and see HIV on every line of this. And it means if you are feeling prejudice and discrimination against one person as opposed to another, Stop it now, because your code of conduct does not support you to do that.